Health experts say this is a good sign in the fight against COVID, matching the forecast that cases and hospitalizations would start coming down in September. And joining us right now is one of the people who predicted that trend, Dr. Edwin Michael with the Center for Global Health Infectious Disease Research at USF. Always great to see you, Doc. Thanks for being here.
Hi, Amy. Yeah, good morning.
So it is good news for us, but now we are starting to see other parts of the country that are really struggling. So while we are doing better, other parts of the country are not. Is that sort of what you would have predicted?
Yeah, absolutely. I mean, we've been looking at, several states with high vaccination rates compared to states with lower vaccination rates, and that's what we are seeing. It's vaccination rates which are driving, what is happening to the cause of the pandemic, going forward.
Why was Florida hit so hard first, and why are other states now seeing what we were seeing just a few weeks ago?
I think, we need to remember before the vaccines took off, right? It really started taking off, March, April, the vaccination rates began to start, increasing. And people, you drop the social measures before the vaccinations had an impact. And that is the reason why we saw Florida, getting the cases increasing in Florida to the extent that it did. That was because people, dropped social mitigation measures. And then we saw that as cases rise, people were voting with their feet. You tend to see a lot of people wearing face masks, and that cooled the pandemic and allowed the vaccination rates to catch up. And that was what happened. So in Florida. Yeah.
Doc, what is next? Because I think everybody, as you just mentioned, we sort of let our guard down in June. We saw the numbers come down. Now the numbers are coming down again. Do we have to worry about how many more shoes will drop, I guess, so to speak? Do we have to worry about another variant, that this is going to happen again?
Yeah. I mean, our forecast is saying if immunity, it's all going to turn on how long immunity lasts, vaccine induced as well as naturally acquired immunity from infection. And that is a big unknown. There are some indications that immunity might drop early, but those are based on antibody studies. Whereas we also have cellular immunity, which seems to be holding firm. So we just don't know how long this will last. If immunity were to last long term, we are on a really good wicket. We are on a trend where this pandemic will actually fade out, barring no new mutants come. And the reason for that is you've got very high numbers of people who are already immune in Florida. About 80% now, according to our model, are already immune, meaning that the fraction who are susceptible, who are the fuel for the future outbreaks and propagation of the pandemic, that fraction is shrinking all the time. Now, provided immunity is long-term, then this will decay, and by the end of the year, we should have this pandemic under control. But if the immunity is not long-term, then we have a problem. Then what will happen is the pandemic will settle and become cyclical, meaning it will become periodic outbreaks. And that the size of the outbreaks, once again, will depend on the duration of immunity, and the interwave periods will also depend on the duration of immunity.
Well, it's a whole new world we are living in, that is for sure. Dr. Edwin Michael from the University of South Florida, we always appreciate your excellent insight. Thank you so much.